Thanks for watching Focus, a program that focuses on community, unity, and service. I'm Chris Giard. October is Mental Health Awareness Month, and research shows that mental illnesses affects tens of millions of people each year in the U.S. Our next featured nonprofit is Mental Health Connecticut. It's a statewide nonprofit organization whose mission is to partner with individuals, families, and communities to create environments that support long-term health and wellness. My guest is Luis Perez, President and CEO of Mental Health Connecticut. Welcome to the show, Luis.
Thank you, Chris, and thank you to Cox Cable for highlighting both mental health and work that private nonprofits are doing during this crucial time.
Absolutely, our pleasure. So let's start off by telling our viewers a little bit of the background of Mental Health Connecticut and its role in the community.
Sure. We were founded in 1908, so we're 113 years old this year. And it was founded on the basis of fighting stigma and discrimination, which, yes, even at the turn of the century, was even more accentuated than today. So through the last 113 years, we have evolved from being an advocacy organization to being an advocacy and community education organization. And then in the last 40 years or so, we have also been providing services across Connecticut, and have offices in several of the towns in the state. We are a full service organization focusing on recovery. So we provide the full continuum of residential services from 24/7 supervised homes all the way to community living where people live in their own apartments and we provide the supports necessary. But of course, a person is not just about having a home, it's about having purpose. So we encourage individuals to seek employment, education, volunteering, whatever it is that their interest is, so that they have a purpose every day. We got up this morning, and whether we wanted to or not, we had to face the cold air and come to work, and that was our purpose. So we want to make sure that we instill that in our program participants. We also provide supported education, as I said, and we also focus on people managing their wellness and whole being and health. So not just their mental health or substance use or addiction conditions, but also making sure that they have access to good health care, both physical as well as dental, and any of the other specialties that they may require due to their health and well-being. And we also talk a lot about community. It is important for people to have a natural support system in their community. And as you mentioned, 1 in 5, it comes down to about 1 in 5 individuals in the United States will have some type of emotional, social, or mental health need during their lifetime. And I think that COVID has certainly exemplified that, in that it doesn't mean that you have to have a condition, right, that you're diagnosed with. But as human beings, we are susceptible to, again, social and emotional and environmental changes like a pandemic, and that affects our well-being. So through our community education, we have done a great deal to not only support those people that are enrolled in our programs, but also the Connecticut community as a whole.
So obviously, we've talked about the 1 in 5 nationwide. Can you talk a little bit about the numbers of the people that you service, and then if there was a spike since COVID?
Sure. So we serve about 1,000 individuals through our programs on a daily basis. We have seen an increase in symptoms or people feeling the stress of the unknown. I think that when we don't have information that is timely, accurate, and transparent, we again tend to feel the stress of that through anxiety. And what we have found is that a lot of our community partners have reached out to us and have asked for us to develop webinars for their staff or their communities on how to manage the change in their environment, i.e. working from home, balancing life with perhaps childcare, elder care, and then also the responsibilities of continuing to work and function at the highest performance level at work.
So I know MHC embraced the hashtag Alone Together campaign during the pandemic, and to alleviate some of that isolation you were just talking about. Are there any other programs, or if you want to elaborate a little bit more about that you guys came up with?
Yeah, it's been a variety and has really depended on the individual industry. So, for example, the Credit Union League of Connecticut reached out to us because many of their credit unions are small shops, right? Just one or two individuals. And a lot of them serve first responders or first-line healthcare workers. And that interaction, right, when they were still having lobby time, gave permission to people to come in and unload. But then what do they do with that information, right? It's almost like compassion fatigue without the skills or knowledge on how to deal with compassion fatigue. Because these people, they come in on a weekly basis to do whatever business, and you develop relationships. And that's what it's about. It's about that human condition and respect for the humanness of it, that they were seeking better skills for their staff. We also developed webinars for families to be able to use the arts, drawing, and how do you use that to work with your children and or for yourself in terms of finding a place where you could capsulate and be able to process those things. I mentioned earlier the webinars around balancing life, and also webinars on, how do I know when what may be a situational anxiety or a situational depression due to the environment that we're in, and where does that cross the line into, I better get some help and identify more resources for myself or my loved one.
Right. I know a lot of people turn to technology to kind of get by. Obviously, we're using the Zoom platform right now, but did MHC start using technology that you hadn't before once the pandemic started?
Yeah. We were very fortunate in that our board of directors was very wise in saying a few years ago, we better invest in technology. Particularly since I would say 60 to 70% of all our work is out in the community. So it was really a practical approach, just so that people could work out in the community, write their notes and contact program participants, etc. But we use Teams, Microsoft Teams. Not a commercial for them, but and so we didn't use that platform in terms of all of our organizational meetings. We did not use it a lot for contacting program participants. So that was a big learning curve. But the fact that we had the platform already in place helped a great deal in making that transition, and a very, very quick transition.
Were there any other challenges that your staff encountered during this, besides, you said, talking about not seeing people face to face?
Yeah, absolutely. And talk about parallel process, right? Just the same things that people that we serve were feeling, our staff were feeling it as well. So we ramped up all of those efforts in terms of making sure that people had the tools and the support to be able to move on. So we not only made available those webinars to our staff, but also started developing process groups on Teams that people could come on and just talk about what they were feeling and the barriers they were facing, and so that we could not only address them from an organizational perspective, but so that their peers could also say, hey, I hear what you're saying because I'm feeling the same way, and normalizing as much as we could a situation that otherwise could have been very stressful.
Great. Well, I know that Mental Health Connecticut is an official silver charity partner of the 2020 Eversource Hartford Marathon.
Yeah.
How has fundraising changed for your organization during these times?
Yeah. So, we have been incredibly fortunate. I have to say that both foundations and community foundations have really stepped up and tried to support private nonprofits in their respective areas around making sure that basic needs, food, for example, became a huge issue in terms of being able to go out and purchase and or be able to find it. Never mind just the funding that it required, because prices also, of course, went up. And when you're on a fixed income, like most of our participants are, it is very difficult to make that stretch. So we're very thankful to the community foundations that supported that. Our corporate partners, for example, we had to cancel our annual fundraising event, The Art of Wellbeing, and all of them said, no, keep the money, use it wisely during this time, and we're here to support you. So
Great.
Kudos to them and our thanks. Individual giving is down, again, for the same reasons that I have explained. While people have probably, experienced some savings around travel to work, you now are at home, summertime hit, so more utilities bills that went up. You're home all the time, so you're probably feeding the kids all the time, and all of those things at a higher rate. So I understand why philanthropy has declined, but we're overall very pleased that our giving is lower, but at a steady flow, a natural flow, and we're very grateful to be part of the marathon again this year.
Great. So obviously talking about contributions financially, but what about people that want to volunteer? What's the best way for them to get in contact with Mental Health Connecticut and some of the things they could do to help out?
So whether you want to donate your time or money, we welcome it all. And the best way to do that is going through our website, which is www.mhc.org.
Awesome.
And you can navigate there and see all the ways that you can contribute.
Perfect. And last question, which we've been asking some of our guests. We've been through a lot, and personally, we've had some time to reflect. So now more than ever, what are you thankful for? It could be personally as well as your nonprofit organization too.
Well, I mentioned natural supports, and I'm very grateful to my family. I am very grateful for the support that I have received. My wife is a rock, but really, I am very grateful for our staff. During a time when they were deemed essential, they reported to work. They made sure that people were maintained, kept safe, that all infection control guidelines were followed, and I can't say enough about what champions they are.
Great. Perfect. Well, Luis Perez, the President and CEO of Mental Health Connecticut, thank you so much for your time today.
Thank you very much, Chris. Be well.